And we're live. Well, welcome to the show, Rachel. Thank you so much for being here.
Oh, thank you so much for having me, Lisa. It's so good to see your face.
Yeah, you too. Well, we should tell people that we have known each other for years.
Correct.
We met when you were a producer.
Correct.
So now you have started your own company, and that's what we really want to talk about. It's in the healthcare space, which
Mhm.
wow, I mean, what foresight you had, because healthcare space is exploding. I know it's one of those areas that people have been saying in this country it needed to be overhauled. It's needed to be overhauled for years. You got in, you're doing great. Can you talk about how you started? The app that you originally launched was called Ouchie,
Yes.
and this is about pain management. Can you talk a little bit about what you're doing?
Yeah. Ouchie was our direct-to-consumer product, which had the goal of helping patients feel empowered and have the tools to more effectively communicate around their pain,
Hmm.
to communicate with each other and to document trends and whatnot. It also had the concept of or the mission of no one hurting alone.
Mm.
Um, and what we found through Ouchie was that some of the patients who were most in need of the services that we provided were either under or unemployed as a result of their pain, or really limited
Mm.
in their physical
Yes.
um, or low life or social abilities. And so
Hmm.
asking them to spend more or utilize any sort of subscription model towards
Hmm.
this wasn't really it wasn't was not only not a bad business model,
Hmm.
but would also not have allowed us to grow in the way that we really wanted to. And
Hmm.
so but at the same time, what we identified is that this was a service that wasn't just needed by patients, but
Yeah.
was also desperately needed by health systems and healthcare providers who
Yeah.
wanted to provide this type of care to patients, but
Hmm.
didn't have the resources in which to do so, or
Hmm.
the training or the skills. And I think we'll get into that a little bit later. And
Hmm.
so we transformed Ouchie from a B2C product
Hmm.
into a B2B enterprise level product. The company name transformed to Upside Health, and our
Hmm.
product became Branch because it is, in fact, an essential part or an essential branch of traditional healthcare.
Yeah. So let's talk about this for a second for our listeners, to better understand when you say that healthcare providers have wanted to offer something like this to their patients. Practically, can you tell us what that means for a patient?
Yeah, so clinicians are compensated, right, in a fee for service environment based off of whatever they can bill.
Hmm.
And the more patients they can see, the more they can bill. And at the end of the day, we have to remember that like being a clinician is a job,
Hmm.
right? And
Hmm.
and it's easy to forget that because obviously care is important and that's what they do, but right, they still need to earn money.
Hmm.
Uh, and
Hmm.
just like anybody else.
Yeah.
So they will maximize their schedule in a way to do that.
Hmm.
Um, but there's also only certain things that a clinician can do in a 15-minute period.
Right. Right.
And so they will address the most acute or most critical components of care.
Yeah.
They will address the things that they're most trained in, which is normally disease progression.
Hmm.
Um, and they will refer out in many cases when it's not aligned with their specialty.
Hmm.
And that leaves a lot of gaps in the care for the patient. So, symptom management, right? That's not
Hmm.
disease progression. Um, Remote care, integrative wellness and care,
Hmm.
um, pain care in the case of this, and
Hmm.
then also really longitudinal care. So understanding what's happening between visits. Those are
Hmm.
all things that can better inform care, but that clinicians cannot do in a 15-minute period.
Right.
They also don't have, when it comes to pain care, training. Most clinicians, like except for pain specialists,
Hmm.
get like a day of training in pain care. And most clinicians know that they even like primary care physicians, neurologists, that like that they don't have the skills required to help with chronic pain care.
Hmm.
But they're limited in what they can do, right?
Yeah.
The tools at their disposal traditionally was refer to somebody else who knows it,
Right.
refer to a PT, refer to a pain specialist, but there's so few pain specialists.
Right.
And so then you as a patient are stuck being like, oh, I've been passed along to another doctor.
Mm-hmm.
So
Mm-hmm.
it feels like you're being pushed off, when
Yeah.
the truth is that, like, it's not that the doctor in some ways wants to push you off,
Right.
but if you're a primary care physician, you can't do, like, you're not allowed to do, you don't have the tools in which to do like a pain block
And
or
what does that mean?
whatever.
What is a pain block?
Yeah, so like an injection into an area of the spine that
Mm.
will, kind of like an epidural, right? Like when
Mm-hmm.
if you had children, that will lock the pain. I'm
Mm-hmm.
gonna get disclosure here. I'm not an actual clinician. I just like play one through
Yeah.
my business.
Right.
But they don't they're not an anesthesiologist by training or
Right.
an interventional pain doc. They can't do that. They
Mm-hmm.
can't they can't they can order physical therapy, but they can't actually do the physical therapy in
Right.
their training, because they also can't bill, like, there's certain codes that certain types of doctors can bill for.
Yeah.
Um,
Yeah.
yeah.
Yeah. Good.
Oh, and I think the other component really is that they know that patients need support from each other.
Right. Right.
And they know that social isolation comes
Mm-hmm.
from being like pushed from doctor to doctor, or living
Right.
in invisible pain, right?
Yeah.
Something that people cannot see. And
Yeah.
so um but again, like, how is a doctor supposed to do that? How is a doctor
Right.
supposed to solve that? They have no training in it, but also,
Right.
like, how are they going to put people in their office? Like,
Right.
there's so many limitations to traditional care.
Right.
um
So is this one of the reasons? Because I think about what happened in, was it like the mid to late 90s, where Oxycontin came onto the market, and it was marketed to doctors, like to
mhm,
probably all sorts of doctors, not just people who were experts in pain management.
mhm.
And you had all these doctors prescribing it, because if you had a patient come in, right, and they were complaining of pain, you're like, oh, there's this thing, right? Is that what led, because doctors are not trained, as you said, in general, like a regular primary care physician or other types of physicians are not trained in this, that's why a drug like Oxycontin was something that ended up getting so deeply overprescribed.
Yeah, I mean, I think there's a bunch of things in play that led to the proliferation and the overprescribing of OxyContin, right? Like, there's tons of think pieces around
Mhm.
the way that it was marketed and how it was marketed, and that adverse effects were downplayed and all of those things. But
Right.
I think one of the main things is there's lack of pain education
Yep.
for clinicians, but there's also lack of correct pain education for patients, right?
Mm.
So
Mhm.
we are taught that something hurts, you take a pill, it gets fixed.
Right.
Um, and in some cases, that's true, right?
Yeah.
Like, we know strep throat, like, those are the most exciting things as a parent, right? Like, when you get something, your child has something that is like, you give them a pill and it's fixed.
Yep.
But the truth with chronic pain is, when it comes to chronic pain, there's not and the pain scale, for instance, is a good indicator of how messed up it is, right? On a scale of 1 to 10, how bad is your pain?
Right.
Well, when you're
Right.
living in chronic pain, it's not single dimensional. There's not always a root cause, like one root cause that still exists. And
Right.
so by giving a pill, it may be addressing one component of that pain, but it's
Right.
not addressing the holistic component, because by the time it's chronic pain, you've got, like, typically a neurologic component, meaning that your brain is firing pain signals from
Mm.
a source that doesn't exist.
Right.
And so that's why VR and behavioral health and um, CBT, like all of those things are super effective and essential parts of chronic pain care. But if you're have a patient that's in really extreme pain, and the only way that you have to measure it is 1 to 10,
Right.
and you have 40 more patients that you need to see today, and you can't refer to a pain site, and you're told that this medicine is an effective, easy solution, and then the patient's not going to come back until another month or 2 months to refill it, then that,
Right.
yes, of course, like it's a very uh it's a very conducive environment
Yeah.
for something like that to be really successful. um and but if you kind of flip the understanding of pain on its head and say, like, unfortunately, like chronic pain, most conditions don't work like that.
Mm-hmm. Mm-hmm.
And that you have to take like a 360-degree look at how we
Mm-hmm.
deal with illness or
Mm-hmm.
disease, and that we have to address it from, like, I think it's kind of like the more of like the population health perspective, right? Like how
Mm-hmm.
these various components all contribute
Yeah.
to your pain, and that, like, one of the things that we've done within our product is actually redefine the pain score,
Yeah.
and break it down into like sleep, pain interference, functional ability, mood,
Mhm.
because that's really what your pain is,
Yeah.
right? And
Yeah.
how these different levers impact the other, and then can you make them all at a level that's livable?
Yep. Yep.
Right? We're not going to reduce, like, the goal, our goal in life is never, like, nothing in life is going to be easy or a
Mm-hmm.
zero,
Mm-hmm.
right?
Mm-hmm.
Life is all about finding a balance of things that you can live with.
Yep.
And pain is really kind of no different.
Yep. So, what inspired you to do this and to create this product and get involved in this area of pain management?
Yeah. So I grew up in a family that was surrounded by chronic health conditions. My mom has
Mm,
lupus. My
mm,
brother has cystic fibrosis. I
mm,
lived in an environment where living with chronic health conditions and effectively managing it was the norm, not the exception.
mm,
And so, in a way, I was really blessed and fortunate when I was 17 and diagnosed with a connective tissue disease, like a
mm,
rheumatologic condition, because
mhm,
I knew the various care pathways I had to take.
mhm.
And I had a built in support system that
Yeah.
was going to hold my hand
Mhm.
on bad days and really get it. Um, and cheer me on like, help me reframe my pain education.
Right.
Um, but I also I was a pre-med in college. I worked in hospitals. I knew that I wanted to have something to do with healthcare because of that really personal experience. But
Mhm.
I also wasn't sure that I really wanted to be a doctor.
Mm,
I felt like
mhm.
there were gaps in care that needed to be um, filled, that weren't necessarily me becoming a doctor in order to do that. And so
Right.
after a career in both journalism and product development, I felt like I had the skill set to do something to fill that gap. I
Yep.
didn't realize, though, to be totally transparent, that when I started this company, and you know this, that I was building a healthcare company.
Yeah. Yeah.
What it just kind of, as the product evolved and I moved into the healthcare space, um, I think also my background as being a journalist and asking questions and not being afraid to ask questions and being really cognizant of how I was filtering the answers,
Yeah.
became a really valuable asset in what ended up becoming a healthcare company, because I didn't need to be an expert. I just needed to be a really good interviewer.
Mm. Mhm.
And I had to be a really good documenter of, like, problems and solutions.
Yep.
And then I could really become a expert or surround myself with experts to fill in the gaps for the
Yep.
problem that I was solving.
So, what do as someone who could theoretically be a patient, right?
Mhm.
One of the things that I keep hearing as it relates to healthcare, and that's a shift in mindset, right? A
Mhm.
generational shift,
Yeah.
maybe.
Yeah.
I look at my parents' generation, And their perspective is whatever the doctor says, that's like, it's sort of gospel, right? That's what
Right.
it is. I have been hearing more recently that we need to be our own best advocates when it comes to healthcare, when it comes to managing. So if you're in pain, right, you need to be your best advocate. What do women need to know about that element? Just the being your best advocate. What are things that women should be thinking about as it relates to that, and what should they be doing?
So I think one of the things, right, as we talked about pain, is the traditional pain scale and how it kind of works against women, people of
Mhm.
color, just because there's so many inherent biases. Like when you say you have a 4, how is a 4 being perceived?
Mhm. Mhm.
And so trying to find effective ways to communicate how the pain is impacting your life
Mm.
outside
Yep.
of, so to be able to say like, if my pain were 50% less, this is what I would do differently. Or these are the things that I haven't been able to do as a result of my pain that I
Yes.
could do before.
Yes.
Like
Yes.
really common daily tasks of living. So
Yep.
then also the clinician that you're working with can know what your goals are and see if they align with expectations based off of what your diagnosis is.
Right.
I'd also understand that like diagnoses change,
Mm.
especially in like the case of chronic pain conditions, women, rheumatologic conditions, like there's so many misdiagnoses. So
Mm.
try not to identify with a diagnosis because that can be
Mm.
really overwhelming, but really put together a treatment plan. And
Mhm.
again, like see how whatever that treatment plan is improving those metrics that you set for yourself. Just like as if you were a professional and you set like KOIs that you're looking to accomplish, kind of
Mhm.
set those like as
Mhm.
these are things like regardless of my, and if I'm not reaching those expectations, like why not?
Yeah.
We're kind of looking at it like, goals that you would set. I
I
think
love
the other
that.
thing that you can do in terms of advocating for
Yep.
yourself or looking
Yep.
is like, what are the various components of care that maybe I need that aren't um, accessible to my clinician, and how can I seek that out myself if it's within your range? So like to be able to say, do you think this could be helpful for me?
Yep.
Maybe it's not a drug or a procedure, but like, do you think I could benefit from mindfulness? Which everybody can.
Mhm.
um, do you
Yep.
think I can? But I just like, do you think this is something that could benefit from PT?
Mhm.
Also,
Mhm.
like, do not think that, because the other thing too is that do not think, again, I've said this before, that like because a doctor is suggesting somebody else, that means that you're being pushed off,
Yep. Yep.
right? So hear it as like a potential resource that is really
Mhm.
worth trying. Now, sometimes there's like various motivations, right? Like they legally cannot do certain procedures and because of insurance, or like not legally, but like they can't, like insurance won't pay for certain procedures until X, Y,
Yep.
and Z is completed. So you
Yep.
have, like, you're not going to ever get that. Um,
Mhm.
but truly, like, personally, I've had like amazing impact from PT. So
Yep.
don't discount like these various alternative treatments and think that like
Yeah.
the doctor is the only solution, but kind of look at the doctor as kind of the hub
Yeah.
to your various care.
Yeah.
And then if something isn't working or doesn't feel good, like you have the make sure that you have everything documented. So
Yeah.
you have access normally to your EHR, your electronic health records.
Mhm.
Make sure that you get, there's also like a lot of mobility in terms of like who your employer has for their insurance company. And if they
Mhm.
switch insurance companies,
Right.
for instance, you might not be able to see a particular doctor anymore. And
Yep.
that doctor has all of your records and imaging.
Mhm. Mhm.
So, and you don't want to have to start from square one.
Right.
Like that's really defeating.
Right.
So make sure that like whenever you get an MRI or a CT scan or an X-ray, ask for a copy of it.
Yeah. Yeah.
Now the truth is like some doctors may want to have the own screening themselves. Like whatnot. But if you have that, a lot of doctors ahead of time will say like, yeah, I'll take a look at
Yep.
it. Because again, too, like their time is money, and if they have somebody, so I think those are like some of my big tips.
I mean, that's hugely helpful, right? So
Yeah.
basically, if I heard you correctly, it's you should really be thoughtful about understanding not just like what's the level, like your number on a scale of 1 to 10 of pain, but what are the implications of the pain? What
Hmm.
can you not do? What are the constraints as it relates to the pain, and really
Hmm.
being thoughtful, and maybe even like journaling that, like making sure that when you go and see your doctor, you
Hmm.
have it and you say, okay, here is what I'm not, here are the implications of this pain so that they
Yep.
can better understand. So that's one. The
Yeah,
next
and I would
thing,
add to that too, like, what are the triggers?
yeah.
That's also really important, right? Like, so I can, because they're going to ask you that.
Mm-hmm. Yeah.
Um,
Yep.
but knowing that, like, at the time when it's bad,
Yep.
maybe jot that down. Don't jot like, think like, oh, it's a 9 right now. That's not going to be helpful. But
Right.
like when I leaned down to pick up my kids, or when I went to the grocery store, I couldn't reach the food on the top level, and
Right.
like I got a searing pain. Write that down. That's
Yes.
like more important.
Yes, I love that. And then, because it's helpful, it's information that is way more useful than a number, because a
Mm,
number is so subjective. Like I might
mm,
have a very high tolerance for pain, or I might have a very low tolerance for pain. So our numbers could be, and the doctor doesn't know that, as you said, they don't know you in that way.
Also,
Um,
if you've been dealing with pain for a really long time, that changes kind of everything too, right? Then like it's not just like a one solution.
yep,
Like
yep,
reframing that too. Like it's not gonna be like getting into it, understanding that like it's gonna be a little bit of work. It's gonna be
yeah,
a long journey, but
yep,
just like
yeah.
work.
Yeah, and
Really
then,
work.
making sure that whatever plan you're coming up with, you have goals associated with it. So it's not just like
Mhm.
you're going to take this medicine, let's say, or you're going to go do this PT. It's going to be, this is what's going to happen, and these are the goals that we are going to associate with it. And
Mhm.
then also, of course, being an advocate for yourself and
Mhm.
making sure that you are are taking, if you do 1 and 2 that we just talked about, and then
Mhm.
you say, okay, here, like I'm meeting this goal, I'm not meeting this goal, and advocating for yourself, like though, like this, that those are things that anybody can start to do,
Mhm.
and hopefully it'll have a positive impact on whatever it is that you're going through and whatever kind of pain you're dealing with.
Yeah, and I think self-care and reflection are really important too when women are dealing with
Mhm.
chronic pain. So like what are the other factors in my life that
Yeah.
may be that like a doctor won't ask a question about, and then that you might not know about, but what are the other stressors that could be impacting your experience with pain? And also, are you taking the time for yourself, like to note, like, are you moving enough? Are you
Yep.
sleeping enough? Are you saying yes to too many things?
Yep.
Like those types of things that we take for granted, especially if we're going through a pain condition, we want to just keep powering ahead because we don't want
Yep.
to be like a lesser version of ourselves.
Mhm.
Sometimes we need to reflect because that's not something that, like, I mean, it might come up in the doctors, but like
Yeah.
that's not going to change with your, like, if things aren't working,
Yeah.
right? Like everything else is, you're like, well, I'm doing exactly what the doctor told me. Wow. Yes, but you still have X, Y, or Z that.
Yeah. I would love if you could also talk just kind of briefly, because I've been taught, I had somebody on the show, and I don't think it's that podcast has aired yet, where it was a lot about the brain. We talked a lot about how the brain functions, both there's the
Mhm.
mental health part of it, and then there's also the brain health, and they're two different things. But
Mhm.
one of the things we talked about is the rewiring of the brain and the possibility to rewire the brain.
Mm.
When you're talking about somebody, and you mentioned this earlier, when you're
Yep.
talking about somebody who has chronic pain,
Mhm.
you're almost conditioned
Oh,
to
100%.
right? It's sort of hardwired. It becomes not hard, but it becomes something
Yes,
that
I
you
mean,
are like, okay, I'm in pain. But you can rewire the brain. Have
mhm.
you been seeing that as a tool, an important tool that people can use when they are dealing with pain?
100%. I mean, it's a key part of our platform. So
Yeah.
one of the problems is, like I said earlier, like pain education. So the way that, pain is communicated, and the idea that, like, a pill or an injection is going to work. No, part of what's happening in a patient who's living with chronic pain is, one, right, their threshold has gotten so low, like things can trigger that
Mm-hmm.
re-emergence of the pain
Mm-hmm.
really easily. And then, even though there's not, maybe the original cause isn't there anymore, it becomes the pain is the primary, like, driver.
Mm-hmm.
So one, like using CBT, mindfulness, art therapy, music, um, all of those components are really important. We also actually paired with our platform a heart rate variance monitor, which is able to indicate, the how your body is at rest, and whether or not your body at rest is kind of more inclined to be triggered easily into this pain place.
Wow.
And there's a lot that you can do. I mean, a pain psychologist is the key part of our team. Same thing with
Mm,
health coaches, because it's all about turning down the volume. And
mm,
once you've kind of turned down the
mm,
volume, then
mhm.
other things can be more effective in terms of treatment.
Yes.
And then you can train your brain. Now, again, like, you might not train your brain, because there still might be a source of pain that is going to exist,
Yeah.
but it gets to a level where the pain interference
Mm,
is not so intense. But
mhm.
again, that's also why, like, VR is really effective. Like, they're all different
And by
tools.
VR, for
And
those who may not know, what do you mean by VR?
virtual reality.
Yeah. And
So
in but
virtual
in
reality,
what context for this?
it's actually was just approved by the FDA, I believe, as a therapeutic for pain management. So you,
Mhm.
like, actually wear. There's some companies out there. Applied VR is one that I know well, but there's plenty of others that you get it prescribed by your doctor,
And what
and they
is it
have
to wear?
you
You
wear, and it's like they show, like, processes and scenarios that, like, help train you on how to better moderate.
Oh,
And so,
interesting. Mhm.
but there's so many, like, amazing tools out there like that.
Mhm.
Some are VR, some are
Mhm.
mindfulness. Like, we have mindfulness on our platform. Some are CBT driven. It's all about, and you know what the thing too is, that, like, not one solution might work for everybody.
Right.
And truthfully, it's normally a combination of things that works
Mhm.
for you. And
Mhm.
then whatever you can actually commit to too, right? Like, some people, certain things are not as accessible, so you have
Mhm.
to find what works for you within your lifestyle, and a combination of what works for you.
Yeah.
Um, but brain training is, I mean, incredibly important, and it's not that pain is in your head, like, you're making it up. No, it's
Right.
just gotten to the point that your brain is on attack. Someone said, like,
Mhm.
the flight or fight mechanism,
Yep.
and it is going to react and trigger that pain
Yep.
in certain situations.
Yeah. Yeah. I mean, that is incredibly helpful. In terms of, thinking about healthcare, you've talked a little bit about this, but how it's evolving and what's going to be happening
Oh my
um,
gosh, so much.
moving forward. What are some of the trends that you see coming in healthcare, and what should we watch out for in the new year in 2022?
Yes, so it's as horrible and as horrendous as the pandemic has been. One of the potential silver linings, if we can find any, is that it has accelerated the digitization of healthcare.
Mm,
Healthcare has
mhm,
been so far behind in terms of, I mean, outside of the utilization of your EHR, which your doctor made you download to maybe schedule things. Like, there was very little. And I mean, most people now have done a telehealth appointment, which they had never done before.
right, right.
And what that's done is allow doctors to say, okay, patients are using these things and they
Yeah.
have value. and then it's pushed insurance companies. And so now things are being reimbursed at the same rate. So you're going to see more telehealth
Yep.
as an early, as an early stage, just like we saw urgent cares replace ERs. We're going to
Yep.
see telehealth replace urgent care in some situations. We're
Mm-hmm.
also going to and you're going to see a lot of devices now that pair with these telehealth appointments to make them even more meaningful. So to
Yeah.
keep people unnecessarily out of high risk environments,
Mm-hmm.
and that the
Mm-hmm.
emergency rooms and hospitals are really going to become for surgery and like advanced stage disease. I
Interesting.
think we're also going to see remote patient monitoring, which is something we utilize
Yep.
for care in between visits.
Yep.
And we're going to see forward.
Yeah.
So that company Forward, which does like the body screens and the
Yes.
analysis. So more of this, like, let's look at the whole person
Yes.
and see what are the various factors that could impact disease later on.
Yeah.
But I think that that's still very much in like the high earner type of healthcare, whereas
Mm-hmm.
we're going to be hopefully moving more into like the population like preventive healthcare for the other 99% of the population.
Yeah.
So I think that those
Which
are
is good news for people like me, right? Who are wanting, like women who are trying to make sure that they maximize the healthcare that they're getting. And it also, I love that idea that you're going to hopefully be treated more holistically, because like you might say, oh, I think I have an issue here. And you go to one kind of doctor, and then you're like, well, that doctor's like, I'm not the right kind of doctor. And it's just really more about if you can figure out a way to get a more holistic treatment. And if this is the direction that healthcare is moving, I can't imagine that that's not going to have a positive benefit for
well,
most
and
people.
I think that, I mean, obviously this push towards value-based care is
Yeah.
at the heart of it, right? So whatever drives value, whatever reduces the cost,
Yeah.
can be important solutions. But I think that obviously patient-centered healthcare is real. I mean, it's going to happen, right?
Yeah.
As patients own their data and can move it
Hmm.
to wherever and however they choose to bring the best outcomes.
Hmm.
So kind of embracing that,
Yeah.
and finding ways that all of the stakeholders that are still involved in healthcare can still win,
Yeah.
right? I think is another driver. And then community-based healthcare, I think, is another humongous opportunity for growth. And as we've seen, like, there's just, if we can build some sort of healthcare infrastructure, especially with like remote care as a growing opportunity,
Hmm.
within networks that people already trust,
Yeah. Mm.
you can do a much bigger impact in terms of preventative care,
Hmm.
um, rather than
Hmm.
that patient going to the doctor,
Yeah.
but utilizing communication tools within that environment.
Yeah. So practically, I just want to make sure that people understand that what that means when you say community based, you're
Mhm.
talking about like digital, probably, in terms of the execution of how that happens, or is that in person? Like, how does that happen from an execution standpoint?
I mean, I think it's a combination. I think that the digital tools will allow for the better gathering of data that would allow non-clinical people the
Yeah.
ability to assist. And when
Hmm.
I talk about community-based, I'm talking about like the YMCA's, the churches,
Yeah.
the any sort of hubs
Yeah.
of social gathering, schools,
Yeah.
huge like a source of that. And so if they have those tools and where people are already comfortable communicating, and then you can triage care more effectively, like, okay, this is not something that can be managed
Hmm. Hmm.
here, like this person needs to go there, but not everybody is going to the emergency room.
Right.
That can create, and it's also building trust.
Yeah.
But I don't know how that, I mean, I know there's a lot of great siloed opportunities of care that are working right now, like in the women's health space, in like BIPOC, like mental
Mm-hmm.
health care.
Yep.
I
Yeah.
think that all of those things, and a lot of them are driven at the community level,
Yep.
and then kind of dispersing using digital tools to
Mm-hmm.
get people to the right care at the right time.
Yeah. Well, I mean, it sounds like there is so much that
Oh
is
my
hopefully ahead
God.
of us in
Oh
terms
yes.
of how healthcare is going to evolve and how it's going to become better and better for the patients. Rachel, thank you so much for what
Oh,
you
thank
are doing in this
oh,
space
thank
to
you.
kind
Yeah.
of innovate and move things forward for patients and for taking the time to explain it to us today. I really appreciate it.
Thank you so much for having me. Again, like I always love these conversations. So if there's any way I can help your community navigate, I'm always here.
We love that. And yes, and we will all make sure to have your information so people know how they can find out what all the great stuff that you're doing. So
Yep.
if they want to follow you, learn more
Mhm.
about it, what is the best way for them to do that?
So on Twitter, I'm at RachieDT, RACHIEDT. Also give me a follow on LinkedIn. We're always growing. We're actually growing our company a lot right now too. So if you are somebody who's interested in helping me transform digital health and pain care, please don't hesitate to reach out.
That's awesome. Thank you so much, Rachel.
All right, talk soon.